Hey guys, so now we got some more fear porn with this guy here named John King. He's out here on CNN trying to report how by opening up, we're basically getting more sick, getting more messed up, not following CDC guidelines, and the spread of infection is just even going up and up and up.
Coronavirus in the West Wing is a messaging disaster for a president who made quite clear this past week his first, his second, and his third priority is shaking the American economy from its coronavirus coma. It is a dicey election year collision of pandemic and politics. And a look at the map makes clear this is a giant public health gamble. Let's take a look at the map as you go through it. This is the country. Here's the color coding. The darker red, that means 50% increase from this past week to the week before in cases. You see, 3 states have done that. 10 states had an increase just this past week of 10% to 50%, meaning cases this week went up 10% or 50% compared to cases last week. 15 states holding about steady. You see them in gold. 21 states do report a decline. Good news in those states, a decline in the lighter green from 10% to 50% of cases. In one, you see up here, Montana, a drop of more than 50% this past week compared to the week before. But if you look at this map, 22 states heading down, 15 steady, 13 states heading up as the president says it's time to reopen. Let's walk through a few of them. Arizona, barbershops, hair salons reopened on Friday. Retailers opened about a week ago. Restaurant dine-in service reopens tomorrow with capacity limits. Now, is that a good idea? Remember the initial White House reopen guidelines. One of the requirements, 14-day trajectory of cases going down. You don't need me to explain that. That trajectory still going up as Arizona reopens. Let's look at North Carolina. Phase 1 began Friday. Retail stores at 50% capacity. Restaurants got to stay with takeout and delivery. Gyms, bars, and salons still closed. So a more conservative approach here. This shows you why. Remember, the original guideline said 14-day trajectory down. That's not what you have as North Carolina reopens. Let's move on to Texas, a bigger state, the more aggressive reopening plan. Hair salons, barbershops, tanning salons reopened Friday. Encouraged, but not required, to wear masks when getting those services. Retail restaurants, theaters reopened 9 days ago with limited capacity. We'll watch the Texas caseload in the weeks ahead. Again, the White House guidelines said you should be going down. Texas is going up or flat, depending on your perspective there, but it's certainly not going down. Just one more, the state of Mississippi. Hair salons, barbershop, gyms can reopen tomorrow on Monday. Dine-in restaurants already open, 50% capacity. Theaters, bars, and gyms in the casinos still closed. Again, remember the initial White House guidelines to reopen. Among them, just one of them, there are many more, 14 days headed down, a trajectory heading down. That is not a trajectory heading down. Mississippi's governor says some risks you must take. New York's governor says not yet.
There is risk every single time you leave your home. There will be risk should you choose to go to any of these businesses that will be reopened. I'm doing this because I believe that I cannot allow our small businesses to fold.
I don't want to do
That's the kind of governor we need. Those who are in support of all businesses, not just one type of fascist business. Shouldn't be just Big Brother in control. All businesses should be allowed to feed their families, and do what they got to do. But now look at Cuomo, Mr. Shutdown Man. As a New Yorker, I cannot stand this guy.
Oops, we made a mistake. I don't want to have hundreds of more people possibly die because it was a whoop.
You're dying because your treatment is garbage. Your facts on this is stupid. You're not doing things the right way.
Under the politics.
Here we got an article on PubMed.gov. It was it was published March 5th, 2020 in China. It was published in the U.S. National Library of Medicine, National Center for Biotechnology. Like I said, on PubMed.com. This is based on the false testing, or false positive testing, which is literally messing everybody up. So let's read it. As the prevention and control of COVID-19 continues to advance, the active nucleic acid test screening in the close contacts of the patients has been carrying out in many parts of China. However, the false positive rate of positive results in the screening has not been reported up to now. These are the results. When the infection rate of those contacts and the sensitivity and specificity of reports results were taken as the point estimates, the positive predictive value of the active screening was only 16.67%. In contrast, the false positive rate of positive results was 80.33%. So 8 out of 10 people showed up with a false positive result. Listen to that, people. That's crazy. The probability for the false positive rate of positive results over 47%. That's crazy. Conclusion. In the close contacts of the COVID-19 patients, nearly half or even more than half of the asymptomatic infected individuals reported in the active nucleic acid test screening might be false positive. So the majority are showing up false positive. That should wake you up, folks. We're going to keep going here.
The CDC wrote a detailed memo offering reopening guidelines. Read those guidelines, and it is quite clear Texas, Georgia, and several other states are way out ahead of what government scientists think is safe. The recommendations, though, were shelved by the White House. The press secretary told us the other day they never had the approval of the CDC director. But government emails obtained by the Associated Press prove that to be another White House lie. The CDC director did sign off on that document, and he wanted to post it as public guidance. This effort to sideline science brought a rebuke from a group representing thousands of infectious disease experts. Its statement reads in part, to backpedal now from the public health measures recommended by administration experts without evidence or resources indicating it is safe to do so would be dangerously irresponsible. The president of the Infectious Diseases Society of America joins us now. Dr. Thomas Feil practices in Akron, Ohio. Dr. Feil, thanks for being with us this Sunday. When you say this, you say it's reckless. You're saying essentially the president makes these calls, that the president of the United States is making dangerous calls and putting lives at risk.
Well, John, this is certainly a sentinel time as we try to reopen our communities and the economy, as you mentioned. And we have to acknowledge that this pandemic has had a significant impact on both public health and the economy. Well, we all want the economy to come back, but we have to do this very safely. And our message from our society is that we still have to use the personal practices that have led us to the present state now, where we're starting to at least flatten the curve. And that means continue to use physical distancing, continue to use masks when we're out in public. Because
physical distancing? We're going to keep getting the cops getting physical with us about not distancing?
We have widely available antimicrobial or antiviral effective therapy and a vaccine. The best defense.
Don't forget the vaccine. You got to throw that one in there, don't you?
Physical distancing. And we also have recommended that the federal government take a stronger role and try to standardize the approach that all the states are taking so that we don't have a backlash. We certainly don't want that. We don't want to go.
They want everybody under the same control. Not states doing what they want to do. Everybody under one rule lockdown. 1984, I must say.
Lockdown, that's going to hurt the economy worse. So all of these practices that have helped us to get to this state, we need to continue as we go forward with reopening our communities.
Well, so then what do you say to the President of the United States, who clearly disagrees with you? He is now encouraging states to reopen, even states that didn't meet the initial, less detailed White House guidelines that included a 14-day downward trajectory in cases. I just went through several states, and there are more that are going up or flat at best that are reopening. If you look at the detailed CDC guidelines that the White House set aside, they were very
same
clear.
CDC guidelines that told us to assume. Listen, guys, the same CD guidelines that told us where the disease caused or is assumed to have caused or contributed to death. Come on, man. CDC just lies. Where they just told us Well, they're still telling you, if you go on Johns Hopkins, you're going to see 78,000 people dead. But as of May 1st, it was changed to 37,000. We'll see that in a bit.
Recommendations for businesses, for restaurants and bars, for mass transit systems. And again, if you look at Texas, you look at Georgia, you look at some other states, they are nowhere near. They're way out ahead, way out over their skis, if you want to use the term. So what should the President of the United States do? Do you believe he's just pushing science aside?
Well, John, obviously our society is
Everybody's pushing science aside. Nobody's following the correct science. Look up germ theory, and you will learn so much more than what is going on.
With the CDC, and the CDC is the predominant policy-making expert that should be listened to.
Like I said earlier, they should be listened to, but look what they've done with the numbers, which keep getting you scared and fear porn and mongering you, so you don't see anything. But we'll keep going. We'll see these numbers. As of May 1st, COVID deaths, 37,000, but on your screen says 78,000.
Recommend what they state, and I think it's important for all the policymakers in the federal government, in the state governments, to look at their recommendations and as best as possible follow them.
And what is the result if they don't?
The video's about to finish. I'm just going to let it play out. You guys let me know how you feel and think in the comments below. Start waking up, people.
Well, the concern is, as we've just mentioned, that there could be a potential backlash on the public health, increasing cases. I mean, if there's increasing cases and it increases admissions to hospitals, that's going to hurt the economy. You certainly don't want to go back to lockdown of businesses because that's going to hurt the economy worse. So the important issue is to maintain safety as we increase and open up the communities.
Doctor, you're on the front lines every day trying to battle.
And if you are taught how to observe, you cease to observe.